Good afternoon. Good afternoon. Welcome to the Mahogany Circle of Hope podcast show. My name is Amita Hassan, and I'm one of the co hosts of our show. My co host is Gloria Bryan. Would you like to say hello to the audience?
Hello, everyone, and glad that you're a part of our show today. It should be very interesting. Thank you.
Thank you. And Susan, would you like to say hello to the audience?
Hello, everybody. My name is Susan Stearns. I run an organization called Pink Lemonade Project, and I'm in Portland, Oregon. Excited to talk with my new friends, Amita and Gloria.
Thank you,
Thank
Susan. Thank
you.
you very much. We usually start out with our Mahogany mission statement. Mahogany Circle of Hope show is to uplift, inform, empower cancer survivors through heartfelt conversations, practical wellness strategies, and a community first approach. We are also dedicated to information and resources. So, once again, welcome, welcome. Susan, I will cover a little bit of your bio and then we will get on with the interview.
Wonderful.
Susan Stern is the CEO of Pink Lemonade Project, a Vancouver based nonprofit. She is a 6 year breast cancer survivor and has a long career in healthcare policy and reform. She is passionate about community collaboration and increasing access to screening and breast cancer supports to all communities. Once again, welcome, Susan. We're glad to have you here. And we'll go ahead and get started with the interview. Gloria, you want to start us out?
I was going to ask Susan if she can tell us a little bit more about herself. I think Amita covered everything, but there might be something. So, Susan, do you want to tell us a little bit about yourself?
Sure, I'll say a few more things. Thank you
Thank
so
you.
much again for having me. What I'd like to share is I've been in the Pacific Northwest about 22 years, although I was born and raised in suburban New York. I've lived coast to coast and have done a lot of work, both in community, but also, believe it or not, in politics. Work for a business, work for other nonprofits, and work for state and local government. And I'm really, as my bio mentioned, I really believe in collaboration, and I think some of the challenges we have before us will require that we all work together to figure out how we move forward and keep doing good work to help people.
I think
Absolutely.
you're right on that. And then, what inspired you uh, to put together Pink Lemonade Project?
Sure. So it actually, I did not found the organization. So the history is that 16 years ago, two doctors in Vancouver named Doctors Alan and Cassie Gabriel, husband wife team, both treated a lot of breast cancer patients and saw the challenges that they had following their medical treatment. And so our earliest programs really were to help fill in that emotional and psychological support when people were done with sort of the hard part of surgeries or chemo or radiation. I got into the picture in, believe it or not, March of 2020. So just as the pandemic was rolling out, I
Hmm.
was the first staff person hired who, in fact, was a breast cancer survivor. My diagnosis was in 2018, and I had a rough treatment year. And then 2019 was a lot of recovery and digging out for me, which I actually often say was a lot harder than the worst days of chemotherapy. And so
Okay.
Pink Lemonade Project, or I've been with Pink Lemonade Project about 6 years now, and really sort of landed in a place where I was supposed to be at the right time. And we've had a lot of growth and are helping a lot more people under my leadership.
Okay,
Yeah,
that,
that's
that's very
awesome.
good. That's awesome.
How
What?
did you come up with
Oh,
the
go ahead.
name
So,
Pink
so the
lemonade.
name comes back to the expression "when life brings you lemons, make lemonade." So, the early, beyond just the Gabriels, but the early sort of supporters and patients and community leaders who were involved in getting the organization up and running, sort of ripped off of that expression and then added the pink of the breast cancer color and came up with Pink Lemonade Project.
Oh,
Okay.
that's great.
Oh, that's
Anita?
great. What gaps in breast cancer or education does the Pink Lemonade Project aim to fill, or what things are you have in motion that you're helping to, erase that gap?
Sure. So I'm going to tell a little history about our programs because we've really evolved a lot. So I mentioned a moment ago that our first program or our programs were to help with the emotional side after treatment. Our very first program was a 3-day retreat for women who were about a year out of treatment. So really sort of late in the game. And some of the thinking around that was just like, when it's that time where like all the medical appointments sort of
Mm-hmm.
start to slow down and you're through enough of the kind of intensity and the side effects and the just sort of the challenges of radiation or chemo that you're kind of coming up for air saying what next or who am I or how do I move
Right.
forward. So our retreats really address that time of recovery and survivorship. um, After that program, we added a peer mentor program where breast cancer survivors were trained by an oncology social worker, actually the social worker who designed our retreats. And we matched peer mentors with women who were more newly diagnosed, really just to be that sounding board, never to offer medical information, but really like, helping people form questions when they go in and see their doctors or just sort of, someone who had a double mastectomy who might want to talk to someone else who had a double mastectomy, like, what advice or what guidance would you suggest for me going into the surgery? That kind of support. And then we really expanded and did a lot more around education. So Pink Lemonade Project's always had really great relationships with all the cancer centers in the Portland, Vancouver metro area. And so we bring in experts to talk about new research topics or lymphedema treatment,
Mm-hmm.
or even just nutrition after cancer, things like that. So then that was really our first 6-10 years. And then the other sort of significant moment about a year after I was hired was the Susan G. Komen National Organization restructured and closed all of its local affiliates, or nearly all of its local affiliates.
What? Mm.
For you in Tacoma, Komen Puget Sound is no longer an entity.
What?
Yeah, I'm seeing very stunned faces right now. Not everybody knows this, but
Right.
during 2020 and 2021, the Komen National Organization reorganized, and nearly all of the 61 affiliates across the U.S. were required to close. So
Mm.
Oregon, the Komen Oregon Southwest Washington organization, which was extremely well regarded, like Puget Sounds, ceased to be on March 31st of 2021. And in that moment, or in that period of time when they announced it publicly in January and then closed in March of 21, they approached us and asked if we would take over 2 of their local programs. So we added then a program targeted for women with metastatic breast cancer. So that's a stage 4 and terminal
Right.
diagnosis. Those of our sisters with metastatic breast cancer, sometimes called MBC, have a very challenging journey. Metastatic breast cancer can be a lonelier experience, just because often the cancer centers or the health system have fewer supports for those with an advanced degree or advanced diagnosis. And then on top of it, because so many of us do get through breast cancer and then go on to live longer lives, those with the terminal diagnosis feel really separate from our experiences. When I really talk about all of us who share the diagnosis, that's the that's the turning point. Some of us get to live, some of us are not going to live from our
Right.
diagnoses. And I
Right.
really am very inclusive, and Pink Lemonade Project's very inclusive. So we have a whole line of programs for those with metastatic breast cancer to get additional support because they need it and want it. And we are able to deliver it. The other thing we took over from the Komen organization was a transportation assistance program, which was a nearly $100,000 fund to help people get to all of their appointments. And that program served all of Oregon and Southwest Washington when Komen operated it. So as our board was wrestling with adding more programs and not necessarily with enough staff or enough money to do it, we said yes, and we just kind of held hands and took a leap of faith that it was all going to work out. And our board agreed to serve all of Oregon and Southwest Washington at that point. So we've really expanded our geographic area to 42 counties now. So that's 36 in Oregon, 32 in, I'm all mixed up. It's Friday afternoon. 36 in Oregon and 6 in Southwest Washington, which is 42 counties. And so all of our programs operate for that full scope. And then after that, and that was 2021, that next year, we actually really added, and sort of to your mission, we added programs ahead of a diagnosis. So we said, we can't just keep serving people after the diagnosis. We've got to get into the business of health information. Breast cancer is a screenable cancer, and we want to do more to get that important breast health and screening information out to communities, and especially communities disproportionately affected by this disease. So we really span what we say the whole cancer continuum now. And so our programs are from that point of education all the way through treatment, recovery, survivorship, and end of life.
Absolutely. Wow. That's awesome. I want to go back to how you said a year after treatment. I think that's very important emotionally. Be, just reflecting on my experience, you go through all that, and then you do kind of feel okay. I survived, but emotionally, it can be something at that point. And I'm glad that you target that phase after the treatment and the diagnosis and stuff. And
Yeah,
by having a retreat, I think that's awesome that you do that so others can, what people can. It's almost like relief. I want to just let it go now and
yeah,
be done with it. So I think that's awesome. And the transportation piece, with picking that up from Susan J. Komen, I think that's one of the main things. I think why people are going through something. Don't you think, Gloria, trying to
I
get to the
do. I
appointments? Yeah.
do to get to and from their appointments. We need to know more about that because so many people don't know about it. We don't. I knew they had one, but um, I didn't. I never hear of what is it? What's the name of
Oh,
that? What they?
recovery is what the American
Yeah.
Cancer Society have for transportation. Yeah.
So I don't know if they still exists or not, but that's really a good portion of what people need when they're
Mm-hmm.
going through, I feel.
well,
And before and after, you know,
cancer's treatment is so many appointments, and I think
It,
that
is.
that's I mean, many, like, again, if you break a leg, there are a lot of PT appointments, and you've got to do all those, and that's part of your treatment.
mm-hmm. Mm-hmm.
Cancer is that and more. So people have you know um, you know 6, 8, 10 chemo appointments, or
Yep.
24, 30, 36 radiation appointments. And if you
Yes.
don't go, you're not getting your treatment. But gas is expensive, life is
Mm-hmm.
expensive, and
Mm-hmm.
it really takes a lot of time to get through all the cancer treatment. So the trying to reduce that barrier of the transportation cost is one thing that we're trying to help with. And just we want to reduce barriers and try to have more people get all the treatment so they can hopefully get through get past their cancer and then live a long and fruitful life.
So,
Absolutely.
Susan, how can we get more information about the transportation so that we are able to help more people here in Pierce County?
Yeah.
And
So,
how?
right this second, like I said, we
Uh-huh.
our programs have been running for Oregon and mostly Southwest Washington.
Hmm.
If I can, Amita, jump ahead on the questions because I have them right in front of me.
Go ahead. Yes.
Yeah, no.
We so one of our board members is from Tacoma and Pierce County, and so we have a direct connection to your community. And so Reverend Allison Kennedy Smith, who
Right.
is with
Yeah.
the AME Church,
Yep.
was probably 3 years ago now, plus or minus, I'm losing track of time, was reassigned from a Tacoma church to a Portland church. So
Uh-huh.
she and I got to meet each other at a community meeting talking about breast cancer. And I was tabling for Pink Lemonade Project, and she was sitting in the audience. And literally at the end of the session, she asked a question and was just her usual passionate, wonderful, amazing self.
Yeah.
And I literally walked up to her at the end of the meeting. I was like, I want to be your friend. So we got connected. 1 3-hour lunch later, we were soul sisters. And she has both really had a great impact on our organization's ability to do work. Whoops, are you there still there?
Gloria?
I think she just got a phone call. But I hope
Yeah.
it's okay. Okay.
No, go ahead,
Okay.
Susan. Go ahead.
So anyway, Reverend Allison is still involved in our board and our work. She and I were able to do some faith-based events in Portland and Vancouver, and we for the last 2 falls have really tried to get more of the churches doing some of the Worship in Pink or Pink Sunday type breast cancer awareness work. But she has also helped introduce me to leaders in women's health. So when I can, I join those meetings, which is fabulous that they're by Zoom because I can just kind of hop in for the hour and a half and get to see everybody and hear what's going on. But in the last 6 months or so, plus or minus, Pink Lemonade Project has applied for a grant through Fred Hutch, which we did receive. And it is an opportunity for us to formally work with Pierce County and leaders in women's health. And the project is, and let me rewind just a little bit, so bear with me, but over the last 2 years on the Oregon side, Pink Lemonade Project has been working with Oregon Health and Science University Knight Cancer Institute, which is the largest cancer center in the state and our single teaching hospital. And we have developed a cancer training for community health workers or our community-based workforce. And so we've learned that, of course, both Oregon and Washington with their Medicaid work have been relying more and more on community health workers, sometimes called community-based workforce, sometimes called traditional health workers, peer specialists, navigators. There's a whole lot of terminology. We use a very broad umbrella. So I'll just say community-based workforce for now. But our in Oregon, at least, because the night is limited to Oregon, we realized that the community in Oregon, it's traditional health workers. So I'll say traditional health worker. In Oregon, the THWs are certified by the state of Oregon, but also have a standard 90-hour curriculum to get the certification. And in that training, there was no cancer information. So we wanted, again, it's one of the most expensive healthcare diagnoses. We know 1 in 3 Americans gets cancer. We know in the Pacific Northwest, 1 in 7 women are at risk of breast cancer, which is higher than the national average. So with the night, we wanted to work on doing a project together and trying to get information about cancer and specifically breast cancer out into communities and really help our CHWs or THWs have some basic information about screening guidelines and, what is cancer in the first place, understand some of the health disparities that's tied with the incidence rates or the number of diagnoses or the death rates or mortality, and then really talk about, breast cancer, just some of the basic terminology. So, what are prognostics? What's hormone positivity? What's HER2 new? What's growth rate? What's triple negative? What's all the vocabulary mean? And so that's been going on for about 2 years in Oregon. And we realized that the need and the interest is on the Washington side as well. So this project with Leaders in Women's Health is an opportunity to actually start building some a trainer group in Pierce County and Tacoma, and see if we can start working with the breast navigator training that Leaders in Women's Health has been doing for 15 years, and work with them and try to identify some trainers. We've already done a sort of run of our training next to their training and how the slides are similar or different, but we're trying to bring that together. And our hope is that we can start working on training more of the community-based workforce in Tacoma and Pierce County. And with that, Gloria, to your question, I'm coming right back to it.
Okay.
With that, it is how do we identify, first of all, what resources are available. So every community's got resources, and we know that. And it's, like you have Leaders in Women's Health, and I'd love to have Leaders in Women's Health in Portland. And that was really Reverend Allison's vision. And she was like, we're going to make this happen. But, beyond that, what are the existing support groups? And then to your question, the next is, what are the gaps? So if transportation is a need, well, maybe then we're working to do some joint fundraising, or we could use the model that Pink Lemonade Project does for how we get funds out to patients for transportation, and work with you to try to build that in Tacoma.
I was wondering too, Susan, when they're doing this training, is there a stipend that they're paid, or if there's what?
That's a great question, Gloria. And we, with these grant dollars, as we've rolled this out in Oregon, we have provided a stipend, and we want to really recognize the time, value, effort, and lived experience of our community-based workforce, and not take it for granted. So we, with the Fred Hutch grant, and again, it's essentially a planning grant, so it's not millions of dollars, but it is enough to get started. But some of those dollars are for stipends for people who attend the training and then who are sort of signing up to train others. And again, it is that it's that what's the word? It's the commitment to making sure that we are valuing people's time and experience for giving back to their community, and for their interest really also in spreading the word about a leading cause of death and illness to women.
Absolutely. I have two questions. The community health worker, which they have in the state of Washington. So you're going to make sure that that's part of their curriculum in their training to be a CHW.
Well, we're going to work with existing CHWs. So Washington's different, and they actually don't have a certification process. So it's different than Oregon.
Oh, okay.
But well, I've actually learned that I think the health authority, Washington Health Authority, Department of Health, has some cancer training, which I just learned about. I've got to learn more about. I've got to look at it more. But we want to at least get some trainers who will help. So as much as we know, the existing community health workers, again, they don't have there's not a defined curriculum, but we want to make sure that they know about the cancer, and specifically they know about breast cancer, since it's the top diagnosed cancer.
I think that would be a good idea. I did take the course, the CHW, but that was a long time ago. So I'm glad you're going to incorporate that as like a mandatory information that they need to know. Now, when you start this CBW program, can the lay person, the community person, can be trained to do this work too for education?
We in Oregon, we've done our training for what we say just community members. So people who are not, don't even identify as CHWs or aren't certified by the state. So we're open to that. Uh, we do a certificate of completion and
Right.
things like that, so it looks official. And it's we get really positive feedback that it's important information. So we're open to that, Amita. And again,
Okay.
it's that, I mean, through this conversation, but again, the grant just came through a couple of months ago, and we're just getting going on the planning. Our organization had our big gala 2 weeks ago, which is a huge focal point of our work. So I'm kind of coming up for air, and we'll be, the planning for the training is going to happen during the summer, and we're looking at a early fall date. So nothing's happened yet. You haven't missed
Oh, okay.
anything.
So you still in the planning works
We are
and
we are just
yeah,
getting going.
okay.
So the grant is new. But if you've got ideas on that, or just really, I'd love to hear now or in another conversation about what you recall from your training, and what was included or wasn't included, and then now as a breast cancer survivor, what you'd be interested in, what you'd suggest to be part of the training.
That's something to think about. I don't think that training was in there, and I think it is needed. And so, if you can incorporate the everyday person, or like you said, peer, someone who's experienced it, and you train them on it, I think that would be excellent. Uh, you know, that I think that's a great partnership. Yep. Um, Back to advocacy and awareness, but with cultural sensitivity. Uh, that's that's what leaders is all about. That's what mahogany is all about. Trying to, especially on the part about the breast cancer and the prostrate, trying to educate those communities that don't have knowledge in those areas. What does Pink Lemonade, or what ideas, or what are you trying to put in place to, you know, close the gap on that?
Yeah, so some of it for us has really just been getting to know more organizations and community, and gaining some trust and building a relationship. But also it's we've got a bunch of programs, and we've been doing those for 10, 15 years. But instead of saying come to our retreats, it's what do you describe as something that you need, and is there something already happening in your community that we could support? And so, I'll just say we work with, the Black community. We've worked, we actually have we helped create or support the first Latina support group in Spanish for Spanish speaking breast cancer patients and survivors in the, it's by Zoom, so you can really come from anywhere in Oregon, but, mostly Portland, Vancouver area is the geographic focal point. And then we actually have we've done a bunch of work with the Native community, and so
Mm-hmm.
it's really saying, everyone, all the communities are getting breast cancer. We're all getting breast
Yeah,
cancer, but
yeah.
it's like, what are the,
Well,
to your
Susan,
point, what are the culturally sensitive supports? And here's just one example where, like with the Latinas, it was really simple to, we found a bilingual, bicultural social worker who knew, oncology social worker. She's, facilitates the group, but it's a partnership with one of our board members who's a Latina survivor, and she works for Oregon Head Start, but she's a longtime parent educator, and she loves working in community and training. And then there's a very well-regarded Portland nonprofit called Northwest Family Services, 40 plus year nonprofit, does all types of services for the Latinx community. And so the support group's a partnership of all three of those organizations. So we work together on that, but it didn't exist alone by the healthcare system. And so as community groups, we could come together and make it happen. And then it's a resource to the healthcare system. So that's an example where we filled a gap, identified a gap, filled it, and problem solved to make something happen. The flip is on the Native side. We have heard multiple times over and over with multiple different tribes and or Native organizations that we work with, is that the term support group doesn't translate into the Native culture. So that is, if we said we want a Native support group, no one would show up. So in the Native world or in a community, the expression of a talking circle is how women come together to express what's going on for them. So just knowing and hearing and adapting, again, the model in the white community support group, they sign up. Latinas sign up, but that doesn't work in the Native community. So how we can be better about listening to what the structure, the name, or the motivation or the incentive might be for people to come and sort of talk about their cancer and talk about the emotions or the challenges. We want to listen first and then figure out how we work together and collaborate, or find funding or find we actually just Native doctor, or Native physician at the Knight Cancer Institute is helping bring some partners together, and is trying to improve some navigation for Native breast cancer patients during their journey, because they just, again, there are barriers and or there's some cultural insensitivities that make people feel left out. And then they go without rather than having some of the supports that you and I might have had during our cancer journeys.
Absolutely. Gloria, you said you had a question.
Well, what I would like to ask Susan, if for our annual, we have an annual fundraiser every year, and we're having it in November. I'm wondering if you would come and just sponsor us in some kind of way for that event, and this way Pink Lemonade could get known, because before this, really nobody knew that anything about Pink Lemonade in this area.
Yep.
So
we're definitely working on people knowing about it. So I'll say that. Yeah. It's a Mahogany Circle of Hope event.
Yeah, yes. It's a Mahogany Circle of Hope.
The annual event.
Fundraiser, our annual yearly. And this is where we try to reach everyone, but you can't. But different organizations and things, we try to get invited. So this would be a great way for you to get more involved. We're all pretty much involved with leaders in women's health and that, but this would be our way of introducing you to our different people that we know.
Yeah, definitely send me the information, Gloria, and the date. And what I'll just say is this minute, my thought is, phew, I'm glad you're not asking me to come in October. So October gets a little busy for me right now.
I know. Yeah, October is busy.
I've joked my whole life that I'm trying to be in two places at once. It's still not working out for me.
I know. I understand.
But let me know about November, and that could be an opportunity. And we don't have deep sponsorship pockets, but let me see what I can do, and let me see what your levels are, and I can even just come and be supportive. But thank you for letting me know about that. I did come up for the leaders fundraiser in March. So
Susan, you were there?
Yeah, I sat in.
You were there, Susan.
I was there.
Gloria, do you remember seeing her there?
No, I
I
don't.
didn't know
I
But
you
don't
yet.
either.
I was
Because we
sitting
had
with
a table.
I was
Mahogany had a
sitting with
table.
Alicia and Queena up front.
You're kidding.
No,
Is that right? Oh,
yeah,
wow.
oh wow.
Oh, wow.
Oh
Well,
well.
yeah.
okay.
I came up.
You'll be at Mahogany's hopefully, and we'll remember that you're there.
Okay. Well, if we have, it's not like I met everybody in the room, but
Yeah,
so
yeah.
I didn't know you yet, Amita. You
Yeah.
That's
emailed
true.
me just a couple weeks ago. So
That's
Well,
true.
now you're
Yeah.
our friend
okay.
Yep, you
because
are a friend too. But yeah, if you were sitting at that table, you were there, and
I
well,
was remind me uh who the woman who was the original head of Carol Milgard Breast Center,
Jackie Ostrom.
Jackie. So
Jackie.
I was sitting at that table next to Jackie.
Is that
Oh,
right?
okay.
Yeah, yeah, and
Okay.
it was great. And I'd met Leanne before, and so I was actually
Yeah.
bummed that Leanne wasn't there. But I got to meet Jackie, and again, it sort of it warms my heart actually. But it's like Reverend Allison is just sort of like a universal language.
She is. She
Yeah.
is.
And
She's a sweet
Allison,
It's
person.
like
She is.
when
any
Yeah.
friend of
Allison,
Allison is a friend of mine. It's great.
Yep.
yeah.
Yep.
And
She's.
see, we were there when it all got started also. So we know Allison from the beginning too.
Yep.
Okay,
Yep.
And she
she's
is a sweetheart.
she's a
Yep.
such a
Very,
great
Yep.
such a
yeah.
great human.
Yep.
I love her.
Yep. Yep. And she can preach, y'all. She can
I
preach too.
know. I've gone to her service. I went to her MLK service last year. I wanted
You
a
did. Oh
I
yeah.
needed I needed
Yep.
some inspiration. So she cheered me up.
Yep,
Yeah.
yep. So,
Yeah.
Lori, do you have any other questions? Wow, you gave us a lot of information, Susan. We appreciate that, and we're looking forward to partnershiping with you and on the advocacy piece, which is kind of sometimes patients or clients. I just wish we would encourage that too. That to speak up for yourself while you're going through the process. I know the process can
That's a
be
big issue
overwhelming
too.
while you're going through it. But I think that's important too for clients and patients to advocate for themselves.
Yeah. Let me I mean Allison offered to actually help us write like a brochure on that. And that
Mm-hmm.
topic is really one of her
Mm-hmm.
personal passion points.
Mm-hmm.
So let me get that back higher on the make it happen list. And I'd love to see if we can get if Pink Lemonade Project can create some like a tip sheet and just
Mhm.
it's so important for everyone
I
going into
agree.
the healthcare
It is
system right
so
now.
true.
And she offered to help with that because that really is something she's lectured and spoken on
Yep.
and trained people on
Yep.
before. And I don't claim to be an expert in that, but I
Me
think
either.
I could help support her so she could get us some materials.
But that would
That
be
would be
nice if you
great.
did have a card that you could just
Yeah,
give to the patient. Make sure
exactly.
you ask this, or if that would be nice to have something like that. And that's
Yeah,
something that we probably could put in our packet or something.
Yeah.
Be sure to,
yeah. And I think that's just good. I mean, at any time that's important, but I think right now, just the healthcare system's having a
Yep,
tough stretch right now, and
yep,
so really to encourage people to self-advocate is more important than ever.
True.
And it may feel a little bit harder, and I think everyone's just
yep,
feeling a little more worn down right now.
yep.
When instead we want to, if someone gets a new diagnosis, we want to encourage them to really stand strong and
Absolutely.
feel empowered along that process.
Absolutely. Absolutely. Well, this is a lot of information. Gloria, did you have any other questions? Or Mary, do you have a question or anything at this time?
I think
Mary,
also on that cheat sheet or the tip sheet that she was talking about, I think it would be nice that if we could come up with a number for the patients that if they did have a problem or if they did run into something then we would have a number that they can call to help that be solved.
Hmm.
Because a
That's a
lot
good.
of
Yep.
times, you have a problem and you really don't know who to go to, you know, to get
Absolutely.
it worked out. You just walk
Absolutely.
away, with nothing. You have tips and everything, but who do you follow up with?
Right.
Yeah.
Who can help me, with whatever happened with me,
Yeah.
whatever
I need to
situation.
learn more. I need to learn a little more about Tacoma and Pierce County. To I think that's got to be more of a local number, Gloria. But let me think about that.
Okay. That's
Uh,
something that we can. And Mary just put a
yeah,
question.
Mary's asking, what keeps me motivated to continue this work? Mary, I'm in the right place at the right time doing the right work. So it's very energizing for me to be in this role. Um, our organization has grown a lot and we are helping more people with real need. And all of that feels absolutely like the most important work right now. And I feel like I'm in a position where I had very good treatment and I am alive today to sort of tell the story and that I can give back and help others who are share a diagnosis that I received myself. And the world is super, especially crazy
Yep.
right now, but
Yep.
also in this lane with this organization and with our partners and with our supporters and new friends like the three of you and leaders in women's health, we can help make conditions better for people in our communities and especially those that get diagnosed. So right now it's all fairly energizing and I'm loving what I'm doing and really the opportunity to work on something new and different like
Yes.
this
Yes.
community-based worker training program is just it's the most important thing right now. So um,
Absolutely.
it's
Absolutely.
it's very energizing and I'm finding like-minded people who want to keep making a difference in their communities and we're able to help others and that feels very, very rewarding right now.
Absolutely.
That is
Very
a good
good,
feeling.
Susan. Very good. We appreciate you. We appreciate your mission and what you're doing, and we can learn from you. But it goes back to community and collaborating with one another. So that's awesome. We have really appreciated you being our guest today. We've learned a lot. You'll have to come back,
I
and
will.
hopefully we'll
We're
see
having you
see
to
you
come back
again.
also to give us your testimony. Cause sound
That's
like you
true.
had a different experience with your treatment and
It
everything. So,
was a journey. There were
yes,
highs and lows, Gloria, highs and lows, but
I know. I
I'm
know
here
the
today.
feeling on that one.
Well, maybe we can have her come back in October. You know,
Yeah.
since that's breast health awareness month, I think
Right.
we need to
Oh,
hear your
that's when she
testimony
says
too.
she's so busy though.
Yeah,
Oh,
but
well, that's
it
true.
Zoom
But it's
45
Zoom. It would
minutes
be
is doable.
Zoom.
Yeah, Zoom
Yeah, it would
45
be
minutes is
Zoom.
doable. It's getting up to Tacoma if your fundraiser was that month is a little harder.
Yeah. Yeah.
Yeah,
Um,
yeah.
but this was a lot of fun and it's really great to meet you. And
Great to
I
meet you
promise
also.
the next, I mean, the next time I know I'm coming to Tacoma, I'll reach out. But we are working on getting a training together with, to really
Good leaders. Okay.
do our first training of the a new trainer group um, for the community-based worker training for Tacoma and Pierce County. So
And what's
it's
your expected time for that? You said late on in the year you
I would
have that.
say late summer, early fall would be train the trainers, and then
Okay.
our goal would be to do a training before the end of the year.
Okay. All
Yeah,
right. I'm just
um,
wondering what the time frame was. Yeah.
yeah.
Okay. All
So
right. Well, thank you so much. A lot of wealth of information
all right,
and we commend you on your commitment to the mission. We really do. Gloria, anything else you want to
No,
say?
I just said I'd like to say thank you again, Susan, for coming on, and thank you for being our new best friend. And look forward to seeing you again.
Yes, yes, yes,
Right.
absolutely.
Uh, Feelings
Absolutely.
are mutual, and this was a lot of fun. And
It
you
was.
you cheered up the end of my week and going into the weekend. So thank you so much, and I appreciate being invited.
Thank
Great.
you. Thank you so much. So, you have been listening to Susan Stearns, the CEO of the Pink Lemonade Project in Oregon, and we thank her so much for her time today. And you have been listening to the Mahogany Circle of Hope podcast. We are also a nonprofit in Tacoma. We are a support group, but you just experienced one of our mission is to educate the community to find out what the resources are. Our support meetings are the second Thursday of every month from 6 to 7 p.m. at Greater Heights Church of God in Christ in Tacoma, Washington. We are on Facebook, and we have our podcast. Our platforms are on Spotify, on Radio Tacoma 101, on YouTube. So you can see these episodes of our interviews with our community people anytime that you want to review or see the information. But once again, we thank you, Susan Stearns, for coming today and being our guest. And my co host, do you have anything else to say before we sign off?
I just want to say, everybody have a great weekend.
Thank
Okay.
you so much.
All right, Susan, you take care and we'll be in contact. And thank you so much for being our guest.
This
Have a
was a
great
lot of fun.
weekend.
You too. Thank you so much.
All
Bye
right.
now.
See you then.